kind of transformational change that we're talking about for health services, public services, some might argue, but let's focus on health services, to be able to say, yes, the consultant is good at this, that. The patient is good, equally as good at this, that. That conversation ain't there yet.
But in order for that to happen, there has to be a kind of acknowledgement of the failings of the system and the professionalisation and medicalisation of care, and about how actually when you break all that down, we can find a way of doing things differently.
A real power shift. And that's what I want to see. People not to be afraid of giving away some of their own power that's connected to the title on their job badge. It's that's hard because there's a lot of fear around in the system. And it is scary.
To actually recognise that they're in a position of power and address that power differential and work with people on an equal footing and generally give, the community or the people involved a meaningful type of involvement, not just the tick box, right? We've got the single patient, right? We're just ticking it off the box. You've got to actually believe in it, have passion for it.
There are other levels that are beyond consultation. I've been to so many consultations, I've got consultation fatigue. I'm fed up of being consulted, thank you. I don't want my experience captured. I want it liberated.
Don't treat us like a free good. This is emotionally laborious, difficult, triggering work. And it's not so much we need our skills building up. It's not paternalistic like that, but we do need to be valued.
I'd like to think that the future of patient leadership is that every single organisation will have patient leaders embedded throughout their work, whether that's at director level, whether that's at cleaner level. It really doesn't matter.
My hope and vision for this book is that it will be a serious disruptor.
The book is an opportunity for people to learn a bit more about people like me who just get through, you survive, but you learn so much. And rather than looking at all that experience as your stuff that you just have to carry around, you can transform it. You can be an alchemist and you can turn that experience into gold dust.
Editing the voice of the patient into, for instance, the format of a case study loses some of the essence of what the patient really wants to say. So I think this book will be a great inspirational learning resource for universities and colleges.
The NHS, as we all know, is sort of really straining. And I feel quite excited that patient partnership is now in policy. It is being recognised as having value. And the challenge is to bring or to put that policy into practice.
You recovered 30% quicker than most patients. I mean, we didn't measure it, but let's say, what is the cost of the stroke pathway? 140, I'm just throwing figures now, 140,000, say. Right, if we can knock a third of that off for every patient that comes in here, how amazing would that be? The qualitative side of that for the patient is that the patient gets better, a third quicker.
Can you imagine if we could be prescribed patient leadership program as soon as you come out of a major surgery or major trauma in mental health? Amazing. And then you're going to, imagine if that was on tap as a prescription.
My hope is for hundreds of patient directors, carer directors, user leaders like that at Sussex Partnership Trust. My hope is for a dismantling almost of the current engagement methods and a taking on board of a different partnership with patients. I'm hoping that infects and infests primary care networks and STPs and all the other damn acronyms we have and will have, that these ideas won't go away, that patients can help.
That's what I want to see. I want an acceptance that there are those of us out there, and they're featured in this book, who are more than capable of working collaboratively, and actually that creates more power in the system rather than be a loss of power. That's my vision. I hope it will happen. Who knows?